Is your teen or adolescent suffering from acne? Wondering what are the newest recommendations and what treatment options are available to them? Today's episode is for you.
Welcome to the Beehive Doc Talks with Dr. Blair Rolnick. As a pediatrician and mother herself, Dr. Rolnick is here to answer your most pressing parenting questions and guide you through the tough spots.
Welcome back to Be Kind Pediatrics. For those of you who are new to the show, my name is Dr. Blair Rolnick. I'm a board-certified pediatrician and mom myself. Today, I want to talk about a topic that really affects our adolescents and teens, and that is pediatric acne. I think this topic is particularly important, and it's important to treat acne because really for two reasons. One, we want to prevent acne scarring, which can be more difficult to treat. And two, I think that acne has a lot of effect on potentially an adolescent or child's overall mental health and well-being. And so there's really two good reasons to be proactive about the treatment of acne in our pediatric patients. So when you think about acne, there's really two different kinds. We usually refer it to as either inflammatory or cystic acne. And those are kind of those painful cysts that you can see under the skin or hard nodules. And then there's also comedonal acne, which is more like clogged pores, so those white heads and blackheads. That's really kind of dumbing it down into two categories. And sometimes there's patients who have both of those things. Why certain patients get acne is not fully understood, although there are some underlying pathophysiology or causes of acne that we do understand. So one way that acne can be caused, especially those clogged pores or those white heads and blackheads, are things that are actually clogging your pores, like makeups or facial washes or moisturizers. The cells themselves can clog the pores. Certain hormones can contribute to acne, particularly testosterone and progesterone, so those involved in puberty, for example. And then three, inflammation, so either dietary inflammation or inflammation from bacteria, for example, in the skin. And so the treatment of acne is really not a one-size-fits-all algorithmic approach to treatment. Really, you want to have a lot of tools in your pocket when it comes to treating acne and individualize that to the patient in front of you and what their skin looks like, as well as their history and the rest of their exam. So when it comes to skin for adolescents, I think there's a couple things they can do right off the bat just to keep their skin clear, even if they're not acne prone. And that's using, first of all, face washes, moisturizers, and makeup that does not clog the pores. So pore clogging ingredients can be things like coconut oil, beeswax, cocoa butter, red dyes, for example. So some nice clean moisturizers and face washes. I really like CeraVe, but there's tons of options out there. You also want to avoid any super harsh agents that are either drying your skin, like exfoliants, for example, because when our skin is dried out, one of the things that it does is actually produces more oil. And some of the bacteria that cause acne really feed off of oil. So you don't want to accidentally send the message to your skin to be making more oil than it necessarily needs to. So avoid those super drying, harsh exfoliants. Three, I know it can be really tricky, but actually avoid picking or popping your pimples. That can lead to infection and scarring. And so if you're noticing that your skin is having a big breakout as an adolescent, the first thing you do is reach out to your pediatrician or your dermatologist for advice. You always want to use a nice, clean sunscreen as well. So zinc oxide is a great mineral-based sunscreen for adolescents and teens. You want to think about your lifestyle and diet. So certain foods, and we're going to touch upon that later, might be actually triggering your acne. And then, again, think about stress mitigation. When you're super stressed out, you do increase some of those hormones that we were talking about that might play a role in acne, like testosterone and progesterone. And so trying to find ways to mitigate your stress is not only good for your skin, but it's good, obviously, for your overall wellness. So let's talk treatment. So again, I kind of think of acne as mild, moderate, and severe. And so when a patient comes in, they're just dealing with mild acne. We have tons of options for that, many of which are over the counter. And I think it's important for parents and pediatricians to be aware of these treatments because sometimes access to specialized care like dermatologists or pediatric dermatologists can either be cost prohibitive or a very, very long wait. So it's obviously ideal that we get your child in to see a specialist, but in the meantime, there are things that we can start to help them start to feel better. And so for mild acne, most of the treatment, again, is over the counter. So you're going to do all those things we talked about. Check your face wash, take your moisturizer, think about your lifestyle and stress, but also think about adding something really simple on, like just benzoyl peroxide. That's a simple over-the-counter medication, which helps with reducing the blockage of those pores. If benzoyl peroxide is not enough, sometimes you can use benzoyl peroxide in combination with an over-the-counter retinoid like adaptoline, which is a very mild and very well-tolerated retinoid. You can use those in combination so that it actually works better. If you're using a topical retinoid that's over-the-counter, it's better to apply it at night. Retinol does not do well with sunlight. It increases the risk of sunburn, but it also destabilizes in sunlight. So it's better to use your retinol at night. You can use your combination retinol, benzoyl peroxide at night, and benzoyl peroxide in the morning if you want to. Make sure that you're wearing sunscreen if you're doing that. So you consider additional over-the-counter treatments like azelaic acid and salicylic acid. Those can help unclog the pores and help with some of those white and blackheads as well. So if it's moderate acne, we can do benzoyl peroxide acid or BPO plus a retinoid. You can try that for a couple of weeks. If you're not seeing improvement, you can add on a topical antibiotic such as topical clindamycin lotion and really give that a good 6 to 8 weeks of consistent use. If that is still not working, sometimes we add on an oral antibiotic for a long time. We're talking about weeks of oral antibiotics. So that's really for moderate to severe acne. Also, when they get into the moderate and severe category, you want to be thinking about things like, are there other potential triggers for this patient? So they have signs of excess androgen, like weight gain or facial hair. In those instances, you want to consider additional potential labs and workups to make sure that there is not another contributing cause to this acne. If you do think that there is a hormonal component to the acne, some doctors will add on an oral contraceptive in that case, such as Yaz. There's a couple FDA-approved options, but Yaz is one of them. And that's really to help control the testosterone and progesterone, particularly helpful in patients who suffer from PCOS, polycystic ovarian disease. Once you're dealing with severe acne and you're thinking about additional pharmacological intervention like Accutane, that is really a patient who needs to be into a dermatologist. So you can start the topical BPO plus the retinol plus a topical antibiotic or oral antibiotic. But that's really a therapy that you're using as a bridge to get that patient in to see a dermatologist. Kind of very briefly about options and ways to think about treatment options out there for your child with acne, or if you have acne, or if you're a pediatrician, the way you might be able to treat some of your patients with acne. What are some other things that we need to be thinking about or talking about in the background? So definitely diet and lifestyle is a big contributor for a lot of adolescents with acne. Talked about how stress can contribute, but definitely also think about foods. Foods can are medicine and fuel. They can help us certainly. And so some foods, like for example, really foods that promote inflammation, like really high glycemic index foods, foods with a ton of dyes, potentially cow's milk for some patients may actually trigger inflammation and worsen their acne. So just think about as the best you can about moving to clean whole foods. So, things that look the way they come out of nature or minimally processed, getting your regular exercise and implementing strategies to deal with stress if that's one of your triggers. So last thing I want to talk about is acne scarring. And this is what we're really trying to prevent. But once you have acne scars, there are also treatments out there that parents and patients should be aware of. And so one of those treatments includes laser therapy, which you can go to a dermatologist to receive. Really, all of the underlying treatments for acne scars are aimed at doing two things: increasing collagen production. If they are hypertrophic scars, meaning they're kind of like scooped out. If they're hypertrophic scars, more like bumps, the therapy is aimed at softening and flattening those. And then if there is a lot of pigmentation, so if they're dark, trying to lighten up that pigmentation. So there's kind of three things we're trying to do with acne scars potentially. If it is a hypotrophic scar, kind of dip down, laser therapy is definitely an option to help increase collagen production. Microneedling is also another great option to help stimulate collagen production. Same thing with radiofrequency plus microneedling, again, helping stimulate collagen production for those scars that are dipped down and need more collagen. For the scars that are hyperpigmented or dark, chemical peels might be an option. Dermabrasion might be an option. Again, these are all things that should be done in conjunction with a pediatric dermatologist. For those hypertrophic scars or keloid scars, Sometimes just silicone sheets, over-the-counter silicone gel sheets, can help soften the scars and improve them over time. Some dermatologists and plastic surgeons might offer things like steroid injections to help flatten those scars and reduce the inflammation as well. Again, for those darker colored scars, additional treatment options might be things like topical retinoids, again, to just help the cells turn over and help fade those dark spots. Good vitamin C, chemical-based peels, and laser-intense pulsed light therapy. Again, these are all options that are going to come from pediatric dermatologist or plastic surgeon. So what are some of the things you can do if you're waiting to get in to see your pediatric dermatologist or plastic surgeon, and you do have some of this acne scarring? So you can definitely consult your pediatrician and talk about things like if they're hypertrophic, like silicone sheets, over-the-counter massages. Some pediatricians, like here, we do offer microneedling in office to our patients with hypertrophic scarring. And just getting an early referral into those specialists, I think, can be super helpful in helping get these kids to the next level of getting their acne under control. So kind of just my final thoughts. I mean, every child's skin is super unique, and what works for one patient might not work for another. So as a parent, what you can really do is help them be consistent with their treatment, support them, encourage them, help boost their confidence by letting them know how great they are. And again, if you have any concerns about your child's skin or acne, or you feel like it warrants attention, reaching out to a healthcare provider like your pediatrician, dermatologist, plastic surgeon, or your pediatrician to get referrals to dermatology and plastics to help develop a tailored treatment plan is really helpful. Overall, I kind of hope you guys found this video to be helpful and empowering, and to know that there are options out there if your child is suffering from pediatric acne.
Thank you for watching The Beehive Doc Talks with Dr. Blair Rolnick. For more episodes and her practice, visit BeKindPediatrics.com, and don't forget to subscribe for more parenting tips wherever you get your podcasts. This information is for educational purposes only. It is not medical advice. Always seek medical advice from a qualified physician.